Let me paint you a picture. You're 68 years old. You've just finished lunch at your kitchen table. You stand up to put your plate in the sink and suddenly the room tilts. Your vision darkens at the edges. You grab the counter to steady yourself. Your heart races. For 15, maybe 20 seconds, you genuinely wonder if you're about to collapse. Then, just as quickly as it started, it passes. You're fine. A little shaken, but fine. You mention it to your doctor at your next appointment. They nod, check your blood pressure, maybe adjust your medication, and tell you, it's probably just orthostatic hypotension. Happens with age. Try standing up slower. 6 months later, you're still getting dizzy, but now it's happening more often. Getting out of bed, standing up from your favorite chair, getting out of the car. And that casual explanation from your doctor, just happens with age, isn't sitting right anymore because this is affecting your confidence, your independence, and your willingness to do the things you love. Here's what most people don't know. That dizziness when you stand up, what doctors call orthostatic dizziness, has at least 7 distinct underlying causes. And in my experience, most primary care physicians only check for 2 of them. The other 5? They're hiding in plain sight, missed in routine appointments, and robbing older adults of answers they deserve. My name is Dr. Nathan Brooks, and this channel is dedicated to one thing: helping adults over 60 understand what the research actually says about their health, explained in plain language, no medical jargon, no runaround. What I'm about to share doesn't come from a single textbook or a 15-minute appointment checklist. It comes from years of working with older patients, digging into the medical literature, and paying attention to the patterns that emerge when we actually listen to what people are experiencing, not just what shows up on a standard lab panel. Here is the truth that most doctors won't say out loud in a rushed appointment. Dizziness when standing after age 60 is common, yes, but common doesn't mean normal, and it definitely doesn't mean untreatable. Behind nearly every case of orthostatic dizziness is a specific, identifiable cause. And when you find the real cause, you can actually fix it. Today, I am walking you through 7 hidden causes of dizziness when standing that doctors routinely overlook. I'll tell you what each one is, why it's so often missed, what the research says, and most importantly, what you can actually do about it. Stay with me through all 7 because number 4 is something 40% of people over 65 are dealing with right now and don't even know it. And number 7 involves a medication class that millions of seniors take daily, completely unaware of this side effect. Before we get into this, I'd love to hear from you. Where are you watching from today? Drop your city or country in the comments below. I read every single one, and it really helps me understand who's part of this community and what you're dealing with. Before we dive into the 7 causes, I need to give you one critical concept. I call it the circulation gap. Here's what's supposed to happen when you stand up. The moment you go from sitting or lying down to standing, gravity pulls about 500 to 800 milliliters of blood, roughly 2 to 3 cups, down into your legs and abdomen. That's normal. That happens to everyone. In a younger person, the body compensates instantly. Blood vessels in your legs constrict. Your heart rate increases slightly. Blood pressure adjusts. All of this happens in less than 1 second, automatically, without you thinking about it. But here's what changes after 60. 3 things specifically. First, the autonomic nervous system, the part of your nervous system that controls these automatic adjustments, starts to slow down. The signals that tell your blood vessels to tighten up, they still work, but they're delayed. Even a 2 or 3 second delay is enough to cause dizziness. Second, many older adults are on medications that interfere with these compensatory mechanisms. Blood pressure medications, diuretics, antidepressants, they all affect how quickly your body can respond to position changes. Third, age-related changes in blood volume, vascular stiffness, and cardiac output mean your circulatory system has less reserve capacity. There's less margin for error. That's the circulation gap. The space between what your body needs to do when you stand up and what it's actually able to do in that moment. And that gap is where dizziness lives. Now, most doctors check your blood pressure lying down and standing up, diagnose orthostatic hypotension if there's a drop, and call it a day. But that's just the diagnosis. It doesn't tell you why it's happening. And the why matters because the treatment is completely different depending on the cause. Let's go through all 7. Cause number 1, chronic low-grade dehydration. Let me tell you about Margaret. Margaret was 71, a retired teacher from Austin, Texas. She came to see me because she'd been getting dizzy every time she stood up for nearly 3 months. Her doctor had checked her blood pressure, found a significant drop when standing, and told her it was just her age. But when I sat down with Margaret and went through her daily routine, here's what I found. She was drinking maybe 3 glasses of water a day, total. She'd stopped drinking much in the evening because she didn't want to wake up to use the bathroom at night. She was on a diuretic for mild blood pressure control. And she lived in Texas, where even in the fall, temperatures were in the 80s. Margaret was chronically dehydrated, and chronic dehydration reduces your total blood volume. When you have less blood circulating in your system, your body has less to work with when you stand up. The result? Dizziness. Here's what most people don't realize. The thirst mechanism becomes less sensitive as we age. A study published in the American Journal of Physiology found that older adults don't feel thirsty until they're already significantly dehydrated. You can't rely on thirst to tell you when to drink. Additionally, many seniors intentionally restrict fluids to avoid frequent bathroom trips, especially at night. It's understandable, but it's creating a hydration deficit that directly impacts circulation. What to do instead? Aim for at least 6 to 8 glasses of water spread throughout the day. Front-load your hydration. Drink most of your fluids before 6 p.m. if nighttime bathroom trips are a concern. And if you're on a diuretic, talk to your doctor about timing. Taking it in the morning rather than evening can make a significant difference. Margaret increased her water intake, adjusted when she took her diuretic, and within 2 weeks, her dizziness was 80% improved. No medication change, no complicated intervention, just hydration. Before we continue, take a second and tell me your name and where you're tuning in from. I genuinely want to know who I'm talking to and supporting here. Cause number 2. Polypharmacy and medication interactions. This is the one that frustrates me most because it's entirely preventable. Polypharmacy means taking multiple medications at once, and it's incredibly common in older adults. The average person over 65 in the United States takes 4 to 5 prescription medications daily. Here's the problem. Many of these medications individually can cause orthostatic dizziness. Blood pressure medications, especially alpha blockers and diuretics, are common culprits. Antidepressants, particularly tricyclics and SSRIs, medications for an enlarged prostate, Parkinson's medications, even over-the-counter antihistamines like Benadryl. But when you combine them, the effect multiplies. One blood pressure medication plus an antidepressant plus a sleep aid creates a pharmacological perfect storm for orthostatic dizziness. A landmark study in JAMA Internal Medicine found that nearly 50% of older adults experiencing dizziness were taking at least one medication known to cause it. And in many cases, their doctors had never connected the dots. Why does this get missed? Because most doctors are looking at each medication in isolation. Your cardiologist prescribes a beta blocker. Your psychiatrist prescribes an SSRI. Your primary care doctor adds a diuretic. No single provider is stepping back and looking at the cumulative effect. What to do instead? Bring every medication you take, including over-the-counter drugs and supplements, to your next appointment. Ask your doctor explicitly, could any combination of these be causing my dizziness when I stand? Request a medication review focused specifically on orthostatic hypotension risk. In many cases, switching to a different class of medication or adjusting timing can eliminate the problem entirely without sacrificing treatment effectiveness. Cause number 3, vitamin B12 deficiency. This one sneaks up quietly. Vitamin B12 is essential for nerve function, red blood cell production, and maintaining the protective coating around your nerves called myelin. When B12 levels drop, one of the earliest signs is dysfunction in the autonomic nervous system, the same system responsible for adjusting your blood pressure when you stand. Here's why it's so common in older adults. As we age, our stomach produces less intrinsic factor, a protein needed to absorb B12 from food. Additionally, medications like metformin, commonly prescribed for diabetes, and proton pump inhibitors like omeprazole for acid reflux both interfere with B12 absorption. A study in the Journal of the American Geriatric Society found that up to 20% of adults over 60 have low or borderline low B12 levels. And many have no idea because the symptoms, fatigue, balance problems, dizziness, are vague and often attributed to aging. Standard blood tests check B12, but here's the catch. The reference range is broad, and you can be in the normal range but still functionally deficient. Optimal B12 levels for nerve and autonomic function are in the upper half of the normal range, not just above the minimum threshold. What to do instead? Ask your doctor to check your B12 level and ask what the actual number is, not just whether it's normal. If it's below 400 picograms per milliliter, consider supplementation. B12 supplements are inexpensive, widely available, and for most people, very safe. Sublingual or injectable forms bypass absorption issues entirely. If you're still here with me and finding this helpful, take a moment to type 3 in the comments. It lets me know you're watching and getting value from this. 'Cause number 4, undiagnosed anemia. Anemia means you don't have enough healthy red blood cells to carry adequate oxygen throughout your body. When you stand up and blood pools in your legs, your brain needs that remaining blood to be oxygen-rich. If you're anemic, there's simply not enough oxygen delivery to meet the demand, and dizziness results. Here's the statistic that should get your attention. According to the World Health Organization, more than 40% of adults over 65 have some degree of anemia. But because it develops gradually, many people adapt to it. They feel more tired, a little weaker, but they chalk it up to getting older. The most common types in older adults are iron deficiency anemia, often from chronic low-grade bleeding like a small gastric ulcer or even regular aspirin use, and anemia of chronic disease related to conditions like kidney disease or inflammatory disorders. Routine blood work checks hemoglobin, the protein in red blood cells that carries oxygen. But unless your doctor is specifically looking at trends or considering anemia as a cause of your dizziness, it might be noted and not acted upon. I've seen cases where a patient's hemoglobin dropped from 14 to 11 over 2 years. Still in the normal range technically, but that drop represents a significant reduction in oxygen carrying capacity. And that patient was getting dizzy every time they stood up. What to do instead? Ask your doctor to check a complete blood count or CBC and review the results with you. Ask specifically about your hemoglobin and hematocrit levels. If they're low or trending downward, ask why. Iron studies can identify iron deficiency. A reticulocyte count can show if your bone marrow is responding appropriately. Treating the underlying cause of anemia, whether that's iron supplementation, addressing a bleeding source, or managing a chronic condition, can completely resolve orthostatic dizziness in many cases. 'Cause number 5, subclinical adrenal insufficiency. This is the one most primary care doctors never think to check. Your adrenal glands, small glands that sit on top of your kidneys, produce hormones like cortisol and aldosterone that play a crucial role in blood pressure regulation. When you stand up, aldosterone helps your body retain sodium and water, maintaining blood volume and pressure. If your adrenal glands aren't producing enough of these hormones, your body can't compensate properly when you stand, and dizziness results. Adrenal insufficiency can be primary, meaning the glands themselves are damaged, or secondary, meaning the signals from your brain telling the glands to produce hormones are impaired. Both are more common in older adults than most people realize. Additionally, and this is critical, long-term use of corticosteroids like prednisone for conditions like asthma, arthritis, or autoimmune diseases can suppress your adrenal glands. When you taper off or stop the steroid, your glands may not resume normal function right away, leading to a period of insufficiency. The symptoms are subtle: dizziness when standing, fatigue, salt cravings, low blood pressure. These overlap with so many other conditions that adrenal insufficiency rarely makes it onto the differential diagnosis list in a standard appointment. What to do instead? If you have persistent orthostatic dizziness, especially if you've ever taken corticosteroids long-term or have other symptoms like unexplained fatigue or salt cravings, ask your doctor about checking a morning cortisol level or an ACTH stimulation test. These tests assess adrenal function. Treatment, if insufficiency is confirmed, is straightforward. Hormone replacement with hydrocortisone or fludrocortisone can completely resolve symptoms. Cause number 6, postprandial hypotension. Postprandial means after eating. Postprandial hypotension is a drop in blood pressure that occurs within 2 hours after a meal, and it's surprisingly common in older adults. Here's what happens. When you eat, especially a large or carbohydrate-heavy meal, blood flow is redirected to your digestive system to aid in digestion. In younger people, the body compensates by increasing heart rate and constricting blood vessels elsewhere. But in older adults, especially those with autonomic dysfunction or diabetes, that compensation doesn't happen efficiently. The result? Blood pressure drops. And if you stand up during that post-meal window, you're at high risk for dizziness or even fainting. A study in the journal Age and Aging found that up to 30% of older adults in long-term care facilities experience postprandial hypotension. In community-dwelling seniors, it's less common but still significant, especially in those with diabetes or Parkinson's disease. Here's why it gets missed. Most people don't connect their dizziness to meal timing. They just notice they feel lightheaded after lunch or dinner, but they don't mention it specifically, and doctors don't ask. What to do instead? Pay attention to when your dizziness occurs. If it's consistently within an hour or two after meals, that's a major clue. Try eating smaller, more frequent meals instead of 3 large ones. Reduce refined carbohydrates, which cause more dramatic blood flow shifts. Stay seated for 15 to 20 minutes after eating before standing up. Some people benefit from drinking a glass of water before meals or having a small caffeinated beverage with breakfast, as caffeine can counteract the blood pressure drop. Talk to your doctor if you suspect this pattern. It's manageable once you identify it. Cause number 7, reduced cardiac output and valve problems. This is the most serious cause on this list, and it's the one you absolutely cannot afford to miss. Your heart's job is to pump blood throughout your body. When you stand up, your heart needs to pump a little harder and faster to compensate for gravity. If your heart isn't able to increase its output effectively, dizziness results. Several cardiac conditions can cause this. Heart failure, even mild heart failure, reduces the heart's pumping capacity. Aortic stenosis, a narrowing of the aortic valve, restricts blood flow out of the heart. Arrhythmias, irregular heartbeats, can reduce the efficiency of each heartbeat. Here's the critical distinction. If your dizziness when standing is accompanied by any of the following, this moves to the top of the list: shortness of breath, chest discomfort, rapid or irregular heartbeat, or swelling in your legs. A study in Circulation found that patients with undiagnosed aortic stenosis often present initially with vague symptoms like fatigue and dizziness. By the time the valve issue is identified, it's often moderate to severe. Why does this get missed? Because many people, and many doctors, assume dizziness is a benign symptom. It's not always benign. In the context of cardiac issues, it can be an early warning sign. What to do instead? If you have dizziness when standing plus any cardiac symptoms, insist on further evaluation. An echocardiogram, an ultrasound of your heart, can identify valve problems, assess heart function, and measure cardiac output. A Holter monitor, which records your heart rhythm over 24 to 48 hours, can catch arrhythmias that don't show up in a standard EKG. This is not something to wait and see on. Cardiac causes of orthostatic dizziness require specific treatment, and early identification can be life-saving. And if you've made it this far and you're getting value from this, type the number 7 in the comments. It's a simple way to let me know you're here and following along. Practical framework, the 5-question protocol for your next appointment. I promised you something you can use, so here it is. Every time you talk to your doctor about dizziness when standing, I want you to have these 5 questions ready. Write them down, put them in your phone, bring them with you. Question 1. Can we review every medication I'm taking to see if any of them, alone or in combination, could be causing orthostatic dizziness? This forces a comprehensive medication review focused specifically on your symptom. Many doctors won't do this unless you ask. Question 2. Can we check my vitamin B12 level, complete blood count, and morning cortisol to rule out nutritional or hormonal causes? These are simple blood tests that can identify 3 of the 7 causes we just discussed. If your doctor hasn't ordered them, ask why not. Question 3. Could this be related to when I eat, and should I try adjusting my meal size or timing? This opens the door to discussing postprandial hypotension, which is often overlooked. Question 4. Do I need any cardiac testing, like an echocardiogram or Holter monitor, to make sure this isn't heart-related? If your doctor says no, ask them to explain their reasoning. If you have any cardiac symptoms at all, push for testing. Question 5. What are the most effective non-medication strategies I can start today while we investigate the cause? This gets you actionable steps immediately. Hydration strategies, compression stockings, positional exercises, meal timing. You don't have to wait for a diagnosis to start helping yourself. Any good physician will welcome these questions. They signal that you're informed, engaged, and serious about finding answers. And if your doctor brushes these questions off or makes you feel like you're being difficult, that's valuable information about whether they're the right provider for you. I want to close with this. Dizziness when you stand up is not something you just have to live with. It's not a normal part of aging that you should accept and adjust to. It's a symptom, and every symptom has a cause. The difference between a doctor who helps you and a doctor who dismisses you often comes down to one thing: whether they're willing to dig deeper than the surface-level explanation. It's just orthostatic hypotension is not an answer. It's a description. The answer is why you have it and what specifically is causing it in your body. You deserve a healthcare experience where your symptoms are taken seriously, where your concerns are heard, and where your doctor is willing to do the work to find the actual root cause, not just label the symptom and send you on your way. The best physicians I've ever worked with understand that quality of life matters. That being afraid to stand up, afraid to get out of bed, afraid to move freely in your own home because you might get dizzy, that's not acceptable. That's not something to shrug off. You have the right to ask questions. You have the right to request specific testing. You have the right to expect thoroughness. And you have the right to find a different doctor if the one you're seeing isn't providing it. Medicine has incredible tools to investigate and treat dizziness. But tools are only helpful when they're used. When a doctor takes the time to look beyond the obvious. When they consider all 7 possible causes, not just the 2 easiest ones to check. You are not being difficult when you advocate for yourself. You're being smart. You're being responsible. And you're doing exactly what every person over 60 should be doing, taking control of their health in the years that matter most. If this video gave you a new way to think about your dizziness or gave you the language to have a better conversation with your doctor, please subscribe to this channel. I make videos like this every single week, practical, evidence-based, no nonsense, to help you understand your health and get the answers you deserve. And I want to hear from you. Leave a comment below and tell me, have you experienced dizziness when standing? Did your doctor investigate the cause, or did they just tell you it was normal aging? Your story might be exactly what someone else needs to hear before they give up or settle for an incomplete answer. If you found the 5-question protocol helpful, screenshot it, save it, share it with someone you know who's dealing with this. Knowledge is power, but only if we use it and share it. Take care of yourselves. Stay curious. Keep asking questions. And I'll see you in the next one.